Hi, good evening. Welcome back. Once again, we are here at the 6 p.m. show. I'm Dr. Chetna Jain, gynecologist, and today we are going to talk on a subject which is not that common but very important, and that is PID. I repeat, it is PID, that is pelvic inflammatory disease. Now, there is another PID in the body, which is prolapsed intervertebral disc. Now, what's the difference between the two? The PID that we are talking is a gynecological problem, while the other PID is a problem of the backbone. So, we are going to talk only of the gynecological PID, that is pelvic inflammatory disease. That means there is inflammation of the pelvic organ. And what are the pelvic organs? I believe all of you know. It's uterus, fallopian tubes, ovaries, vagina. This is the genital organ and especially the internal genital organs. Now, why it is important to address this issue? One, it is not commonly talked about. Second, it affects the women gradually and slowly. And third, it could have very severe consequences for the younger girls who can have difficulty in conception and for the older women who will have a lot of infection leading to difficulty in performing the various tasks. And they can also have very severe backache, which is compromising their daily life in terms of pain in the lower abdomen, back, and so on. So let's come to the symptoms. Or first, what is it and how it happens and how it can be prevented. So one is you will find some yellowish, grayish, whitish vaginal discharge. So this starts from here, and this leads to this is in the vagina, and this leads to ascending infection of the uterus, which travels across the uterine cavity from the fallopian tubes into the cavity and finally out of the fimbrial end, that's the end of the fallopian tube, and goes and rests onto the ovaries and on the intestine and surrounding tissue of the pelvis. So, what happens is because of this infection, gradually and slowly, just like cobwebs, a lot of adhesions are formed into your pelvis, which disturbs the anatomy of the organs. Now, this can lead to a painful sex or pain present all the time, painful periods, heavy periods, or whenever these women have a lot of difficulty conceiving. And in the older age, when it becomes too much, there is backache. And suppose if these women need pelvic surgery for any reason, it is very difficult for surgeons to operate because of the dense adhesions. It's all a frozen thing. It's very difficult to go through the various organs in the pelvis if it's a completely blocked pelvis. So it is important to treat it. So first thing is that if you have any vaginal discharge, it needs to be addressed and treated appropriately at the right time. So it is very important to maintain healthy sexual practices so that you don't get vaginal discharge. So there are certain points that you keep in mind. That is, one is always use cotton underwears. Expose your private parts to the air and the sunlight if possible. Do not use soap to wash your private parts. Maybe sometimes you may use a personal wash, but it's best to use the normal water. You may clean with curds or vinegar sometimes. You should wipe your private parts from front to back and never from back to front. Whenever you're passing gas, you should raise your bum slightly so that you pass on one side. Do not squeeze yourself because then the gas enters the vagina. Then you keep your ass very clean by washing it properly and do not just use jet. Steam iron your underwears very well. Wash yourself after the sex. And finally, any disease, if you have, go and see a gynecologist. So if you look after this, if you do everything, there's a very small chance that you develop infection. Now, still there would be some women who have taken all the precautions and still they can develop the disease. And these are the women at risk. So these are the women who are genetically predisposed or they have a family history. They are diabetic, They are immunocompromised, like they're taking steroids for some or the other, like arthritis or some other reason, or they are HIV positive or similar immunodebilitating diseases. So, if it is so, the deficiency diseases can lead to increase in your chance or risk factor. And in such a scenario, even the mildest of the infection needs to be treated early and appropriately. So what women do is they go once, they take the treatment, they use half, they throw half, and they never go for a return check to see that all is clear and fine. You must also stick to one sexual partner. All women who change their partner or they have multiple partners are more likely to have these kind of infections. If you think that you need screening, it's a good idea to screen yourself and your partner annually for any STIs. So if there's any personal history of sexually transmitted infections, this can also precipitate the uh, PID. Now, there are various organisms. The most common organism is known as chlamydia, which is a hybrid between a bacteria and a virus. It is a very, very resistant organism, and once it comes, it doesn't go off easily without creating enough adhesions. So there are ways and means to prevent it. The most important protection that you can use is use a barrier method of contraception that prevents you, that protects you against the infection from your partner. And anytime, if you notice any kind of lesion or discharge, then you must abstain till it is completely clear. So all this is very relevant for you so that you don't suffer any kind of disease. Never ever ignore a greenish discharge, yellow discharge, or for that matter, a white discharge is very common because majority of the women will talk to each other. They say leukorrhea so keeps on happening, and you don't have to see a doctor for the same. Let it be, doesn't matter. So women only come when it itches so much that they can't sleep, or before that, it's very rare to see women. So it is important to maintain your hygiene, and it is important to uh, keep yourself clean, and it is important to aerate yourself, apply sunlight, and ensure that you don't have any infection. Anytime you see any kind of streak or staining of the underwear, this could be an early indication of infection. You must also steam iron your underwear to prevent reinfection from the underwear itself. Because a lot of bacteria and viruses, they do not get washed off even after washing the clothes at 40, 50 degrees. So in this scenario, it is important after washing and drying, you can use the central area and steam iron them very well with a steaming iron so that the they are killed and there are no spores, and so there is no reinfection from the from your undergarments. Similarly, one should be very, very careful in using the public toilet. If you think you're not sure, you can use stand and peel so that you don't sit on the dirty seats. You can also, when you go for trial of your clothing, you have to be sure that your inner clothes are dry and you do not end up wearing, because if you are wet, then you may transmit the infection to the clothing, and clothing can also transmit the infection to you. So it is very important for you to be dry when you're trying those trousers or any tight clothing at a fashion store. So if you take such kind of precautions, there is a good chance that you will not develop PID ever in life, no infection. So stay safe, stay healthy, stay absolutely free of infection. This is what I can all pray. And we are here, open forum, to take your questions. Even if the questions are not relevant, we are okay to take that. So if you have anything, do let me know. Otherwise, you can WhatsApp me at 9910907222. So here we go. I can see a question here. What are the, just a minute. What are the symptoms of PID in a female? Okay, so we talked about it, but I repeat. So there could be colored vaginal discharge, pain in the lower abdomen, pain in the low back, a stretching sensation, a painful intercourse, difficulty in conceiving, heavy periods, backache, and on ultrasound you can find certain findings. So these are the symptoms that one should suspect that there could be PID. Can you have a pelvic infection without having an STD? Not all pelvic infections are STDs. Chlamydia is one which is considered an STI by some and not by others. So there are bacterial infections and fungal infections which are non-STI. The STI infections typically are various like HIV, hepatitis B, C, you have herpes, you have other rare like chancroid, you have syphilis, and there are others. So they are less likely to cause problem to the pelvis compared to the chlamydia and other things. What happens if PID is left untreated? So tubes get blocked, the uterus gets infected, and there's long-standing pain, difficulty in conceiving, lower abdominal pain, backache. So much so women are lying down in the bed and not able to perform the daily chores. So it varies from people to people. Not everyone will have very serious symptoms, but a lot of will have very serious symptoms. What does PID discharge look like? Now, PID discharge could look like either yellow or gray or green. It could be odorous, smelly, like fishy smell, or some other foul smell, and it stains underwear and it will uh, burn your private parts and you will find yourself red. So this is a very typical PID discharge. Thank you so much. We'll be seeing you next week with another topic. If you have any particular interest, do WhatsApp me on 19910907222. I repeat, 9910907222 so I can pick up a topic of interest. Thank you so much.